This video will teach you how to ambulate your patient with tethers safely. A tether is any line or cord that is attached to the patient. Ambulating with tethers requires careful attention and preparation in order to prevent the patient from falling or the tether from being dislodged from the patient during ambulation. Megan is going to show you some examples of tethers. This is a nasal cannula used to deliver oxygen to the patient. This is a blood pressure cuff attached to the vital sign machine and a pulse ox tether attached to the vital sign machine. This is IV tubing attached to the IV pump. This is a Foley catheter bag. Next, Megan's going to demonstrate how to ambulate a patient safely with tethers. First, assess your environment for tables, chairs, crowded spaces, trash cans, or wet floors and clear your pathway from any obstacles before you ambulate your patient. Remember, the number of tethers determines the number of people needed to ambulate the patient. If your patient has 2 or more tethers, find a helper. Use a gait belt and non-skid slippers to decrease the chance of falls during an ambulation. Confirm that the bed is locked and at the lowest height to make it easier for the patient to stand. If possible, reduce the number of tethers before ambulating by talking to the nurse about which tethers can be discontinued or altered before ambulation. For example, the nurse may be able to saline lock an IV or connect oxygen tubing to an oxygen tank. Make sure you know how many tethers your patient has before ambulating. Don't forget about the Foley bag. Ask the patient if there is anything pulling before you stand up. And ask the nurse just to make sure how many lines or tethers does the patient have. Communicate to your team. If you have a helper, designate someone to watch the O2 tank or to follow with a wheelchair. Position the tethers appropriately prior to ambulation. Always keep the Foley bag below the waist to reduce the risk for UTIs. If the patient is using a walker, you can put the Foley bag to the walker. Help the patient with your dominant hand and hold on to the oxygen tank with your non-dominant hand. Continue to be aware of any tubing during movement so that it does not pull on the patient or become dislodged. Always have a backup plan if the patient becomes fatigued, dizzy, or falls during the ambulation. Communicate to the patient. Tell them beforehand the direction they are going and help them step by step.